So this is just a little bit of an introduction to South Carolina. We work at the Ultrasound Institute. So just to tell you a little bit about it, we have a school dedicated completely to ultrasound education. And the University of South Carolina School of Medicine was the first university in the entire United States to integrate ultrasound across all 4 years of medical education. So we have been around for about 19 years. And we've developed a very nice and robust program, and now we're at a position where we teach other medical schools how to start their own programs just because we've been around for such a long time. Just to give you an idea of how busy we are, in last year, the Ultrasound Institute hosted 225 events, and we taught more than 6,000 people how to do point-of-care ultrasound, and that's just in 1 year. So it's a very, very kind of active environment, and a lot of people come through. And we teach a lot of different kind of entities, from practicing physician to residents, faculty members, PAs, pretty much everybody. And the Ultrasound Institute also holds 6 domestic and international patents related to ultrasound education and product development. So the objective of my talk today is to just break it down into 3 different parts. The first part is who is learning point-of-care ultrasound today, and I hope you'll be surprised a little bit by who we're teaching. Number 2 is how do we teach ultrasound to different groups and tailor the curriculum to reach our target audience. And 3 is how do we assess and follow up just to make sure that our target audience actually learn the material and kind of follow up with them. So the first one is who is learning ultrasound. And you'll be surprised to know that, it's not surprising that practicing physicians are wanting to learn ultrasound. Nurse practitioners and physician's assistants are also on board. We're also teaching registered nurses with the use of ultrasound. We're teaching medical students. That's our main focus. But also, we teach college students, high school science teachers are learning ultrasound. Middle school and elementary school teachers, even young kids, are learning ultrasound. And of course, zookeepers and veterinarians. So it's a really wide array of people. So I'm going to talk about a little bit about each one of those and how we can approach the curriculum in order to make sure that they're getting the focus that they need. So for practicing physicians, it could be older or younger. So we have a lot of schools in the United States who have not incorporated ultrasound into the curriculum yet. So a lot of those doctors who may want to add that to their kind of clinical exam would come over, who are younger, who maybe just graduated recently and have been in the field for just a few years. They come over and they learn ultrasound. But it's not only limited to younger physicians, it's also older doctors who have been seasoned and have been practicing medicine for 20 years, who maybe have heard about ultrasound and are curious about how they can incorporate it into their physical exam as well. So how do we reach those people? So what we did is we developed something called the Continuing Medical Education Workshop. So we developed a very kind of intense workshop over 2 days where these physicians will come over, and we offer it every 2 months, so 6 times a year. And it's really focused on people who have very little or no experience with ultrasound. So we start all the way at the beginning, and we build each day on the curriculum. And this is the course that Dr. Ikosi actually took part in it when she came and visited us last November. So she's a little bit familiar about this. Just to give you a little bit of a brief overview, it's a 2-day course, and you can see it's very kind of intense. There's a lot of material incorporated in it. And it's kind of structured where we do a lecture, and then we go into a scan lab and practice it. So we talked about physics, abdomen, IVC, AAA, neck, lung, procedures, cardiac, MSK, a lot of stuff in 2 days. So the way this is structured is we do a didactic session first for about 30 minutes, let's say on cardiac ultrasound. And while the material is fresh in people's minds, we transition into the lab. And we have a lab set up with stations like this with a big screen TV. And it's a very conducive environment to having a group learning environment. So we break up the students into 4 or 5 around each station. And then we have a faculty member there, and we actually have them perform the ultrasound at the bedside. And then after, they kind of go in, they break up into small groups, and there's Dr. Barron, is one of the instructors there, and he's kind of guiding that group. So that's kind of the way it is set up. And we also use something called very simulators. I don't know if you've heard about, maybe flight simulators. They also have ultrasound simulators, and those are great because in a teaching environment, really, we're not a clinical setting, so we don't have crash carts in case of emergencies, so we can't really bring people with advanced pathology into the school in case something happens. We can't really handle this situation. But with these simulators, you can simulate pathology. So you can load a congestive heart failure module, and it mimics all the different symptoms that you would actually see on a real patient. So the students get to see normals and then compare it to pathology with the use of simulators. So really, this has been a very positive thing to add to the curriculum, and we get a lot of positive feedback about it. Nurses and nurse practitioners are learning it, so there are kind of two different ways of handling this. There are very basic applications where nurses can, for example, if they want to do bladder volume or just like for peripheral vein insertion, something like that, they use ultrasound. And then we have critical care nurses who may want to kind of a little bit more advanced applications. For example, assessing the ejection fraction of the heart, or looking for effusions or something like that. So even nurses are getting in on the ultrasound as well. This is our brand new nursing school that we just finished building, and it's about to become the first nursing school in the United States that has its own ultrasound institute. So even the nurses themselves are having their own school now that's we're implementing. Medical students is our main focus, and so we teach ultrasound across all 4 years of medical school. And the way it's kind of done in the curriculum is the first year we concentrate solely on anatomy. In the second year, we introduce physiology and pathology. The third year, when the students start rotating into the hospital and the clinical setting, they get a handheld ultrasound machine that they plug into their phone, and they take it with them on their rotations. And they are required to acquire a certain number of images while on real patients in the hospital. And then someone like Dr. Barron can pull those studies from the cloud-based storage and give them feedback on it. So that's how they get to know, if they're doing it correctly or incorrectly. So they get to kind of follow through with that. And during the fourth year, what we do is we have something known as an ultrasound elective, where now that the students have had 3 years of ultrasound under their belt, they come back the fourth year and they teach the first year and the second year medical students. So you can see kind of it's just like a full circle. They start at the beginning and then they come back at the end and they become the teachers themselves. And it's been an amazing experience. Every time we ask them about it, there's nothing but positive feedback from them. So the first year, just to give you an example of how it's organized, we have the top portion here is these things that are called structured labs, where, like for example, we introduce echocardiography or liver, gallbladder, urinary bladder, knee and shoulder, carotid, things like that. So they come in and we hire standardized patients from the community, and the students get to practice on them. And those could be, varying body habitus. So we have people who may be medical students who are easy and young and they're very easy to use ultrasound on, to more kind of larger, people where it's a little bit more challenging. So the students get to a variety of models to practice on. And then we have something called open labs. And those are labs where we carve out a 3 or 4 hour session where the students can come in and practice on each other. So you guys would come in and someone would lay down on the stretcher and everyone in the group will scan them. So those are kind of where you really learn ultrasound, because you don't have any specific faculty member standing behind you telling you how to do it. It's a much more laid back environment, and you just get to play with the equipment and practice it yourselves. So that was the first year, and what we do, we try to match it up with what's going on in the class. For example, if the students are learning the cardiovascular system during that block, and they just finished dissecting a heart in the gross anatomy lab, then that next afternoon they come back to the Ultrasound Institute and they get to scan each other and then see how the ultrasound beam actually slices through the heart to create a moving picture. So we call this a living anatomy. So after they see what the valves look like during the dissection, they get to see how the heart works and how everything moves and the valves open and close, and learn the anatomy that way as well. During the second year, we start incorporating additional views. So at the beginning, maybe the first year they did only the peristernal long and the peristernal short, but maybe like in the second year they get all the different views, the apical views, they get the subcostal views, so a little bit more advanced. Then we go into AAA. Then we start incorporating protocol like the FAST exam, the RUSH exam, the CLU exam, all these things because they're a little bit more proficient at that point, and then the DVT ultrasound. And then what we do is we kind of try to pair it with how the function of the heart and what's going on. For example, we ask the students to put the transducer here, get a peristernal long axis view of the heart, and at the same time, they use a stethoscope and they get to listen to how the heart.
Without moving the transducer, auscultate the chest and listen to the heart sounds. Correlate the S1 and S2 heart sounds with closure of the mitral valve and aortic valve, respectively.
So do you see how when the valve closes, it actually creates the sound, and how the mitral valve is first for S1 and the aortic valve is second as S2. So they get to kind of hear it and see it in real time and correlate the sounds together. For example, we have something like this where you see the heart beating and you hear this S1, S2, but you also hear something else. Do you hear it? You hear that psh, psh, psh. What do you think that is? They sound like a murmur to you. And then if you don't really what you can do is you can superimpose the color Doppler on top of it and actually see the aortic insufficiency in an image, in a video, where you can actually confirm it as well. So it's not only can you listen to it, but you can see it here. So that is the power of ultrasound, where it actually gives you the image to confirm what you're hearing is correct. We also do some other things that have never been done before, things that we're working on. For example, with the deep tendon reflex, where you use the hammer to kind of see. So what we did here is we put an ultrasound transducer right at mid-thigh, and we were able to kind of see the muscles and the cortex of the femur. And what we did is we utilized M mode, and you can see as the muscle contracts, it creates these little deflections, and you can actually see how the muscle contracts. So what you can do with that is you can freeze it and then measure and get an actual kind of measurement here, where you can see the onset of the contraction, the peak contraction, and then the relaxation, and you can measure and get actual data from how much did it do. It's not just looking at it, but you get some actual quantitative measurements. So that's something that is kind of we do. So during the third year, like I said, the medical student get their handheld device that they can take with them on their rotation. There's just a picture of them there. And what they do is they kind of plug it into their phone, and this is just a representation of how each student on a certain date had to get a certain number of images. So you can see how each time they acquire an image, there are these images here, and then someone like Dr. Barron will pull down these images from the cloud, and they'll give them a little bit of feedback, like was the gain correct, was the focus correct, was the depth correct, and they can write down some comments for them, so that way they'll know how they did. So someone keeps up with them. And during the fourth year, this is the last year, and this is the little elective that I talked about, where they come back and teach. So we have a very kind of, a syllabus for them of things they have to accomplish. And you can see here the M1 lab, the M2 lab, the PA lab. They have to come back and teach those labs. So here's an M4 student, and you can see here the younger students at the bedside, and they kind of guide them, and they actually do the instruction. And this is just, I put a couple of things of feedback that we heard recently from some of the students, where it says ultrasound is one of the best aspects of our school, both enjoyable and informative. I feel that the ultrasound component of our curriculum is valuable and distinguishes our school from others in the nation. Ultrasound is one of the components that always reminds me why I wanted to go to medical school. I think it's a privilege that we have the ability for students to not only utilize ultrasound, but become proficient at using it as such an important clinical tool. And also, I love the ultrasound program and feel well prepared for using ultrasound in the hospital setting. So you can see a lot of the students that speak very highly of it and really enjoy the process of learning ultrasound. We also teach college students who may be thinking about going into the medical field, but maybe they're wishy-washy about it. So just kind of we capture them, we teach them how to do ultrasound, and maybe that would excite them. We teach high school students, middle school students, and even elementary school students. So what we do, I don't know if you have summer camps here where you can go and do like an athletic summer camp or a soccer camp or something. We have ultrasound camp. So what we do is we bring the students in and we have a week-long program for them. For example, we do like a welcome session and we do some teams and things like that. And then on the last day, they get to bring their parents and then they show them kind of what they learned. So here's an example. This is just this year's the camp. These are the students here who came and participated. And you can see these are our M4 medical students who run the camp. So they're kind of the counselors and the teachers. And the students get engaged and they get to do it. And we also play games with them the whole entire week and do stuff. And then at the end, they bring their parents and they kind of show off what they learned. So it's been an amazing experience. And we've been doing it long enough now where the original students who came in a few years ago have actually gone into the medical field based on their exposure to this. So you can see how amazing it is for a young kid to kind of see their own heart or their friend's heart and get all excited about being able to do that. So it really makes a difference in the end. This is just a little video to show you what they're saying about it.
We've been learning how to perform ultrasound using simulators in patients, and it's been really amazing.
I never knew what ultrasound was. I only thought it was scanning pregnant women, but apparently there's more to it.
We've scanned the heart, the thyroid, livers, kidneys, basically everything.
We got to practice on the simulator, which was awesome, and then we actually got to do real ultrasounds on medical school students.
The simulators, they helped a lot. You got the feeling of how to do an ultrasound on the mannequin before you did it on an actual person.
And it's a good starting tool because scanning a patient is really much harder than a simulator.
Without the simulators, I don't think I would have been very good at it because that taught me the hand-eye coordination I needed to use and how to orient the probe. It helped me to get a grasp on how to perform ultrasound. With the simulators, you get to see this stuff, but with the live patients, you actually get to see real human anatomy and real hearts and real organs, and it's amazing.
You're intimidated by it at first, but once you get the hang of it, it gets a lot easier.
My favorite thing was being able to work with the medical students and actually being able to get them to help me if I had any questions.
All right, so do your tweaking so we can get all 4 chambers in view here.
During the program, they split us up into teams, and we were able to play games on the simulator.
We were seeing who could perform the most accurate scan in the least amount of time, and I'm really competitive, so that helped me. That gave me a little extra motivation to be better at ultrasound.
It was really fun because it was competitive, and also it really encouraged everybody to do their best.
Games actually do help. You want to learn a fun way to teach students because always sitting in front of a board and listening to people talk is not always how some students learn.
During, let's say, something like a PowerPoint, sometimes you can get bored and just totally zone out and not hear a thing that's being said. But when you're playing the games and you're actively engaged in it, then you're...
That's just a little bit of an idea of kind of what they're saying about the summer camp. So science teacher, what we do is we invite biology teachers who teach in high school, and they come and they spend a week with us, and we introduce new tools of technologies to the classroom. So after they learn how to do ultrasound for 1 week, before they leave to go back to their school, we give them a laptop unit to take with them for 2 weeks. And instead of using a plastic model of the heart and teaching the students how to do it, they ask one of the students to hop up on the table, and all the other students scan them them, and there's no ionizing radiation. It's safe, and everybody gets to learn, and they just kind of feel like it's such a fun way of being able to see the anatomy. So this has really been a very, very successful program, and I have a tiny video to show you what these teachers are saying this time.
So we're learning about ultrasound equipment and how we can incorporate that in our classrooms.
Ultrasound would be great in the classroom. First of all, it gives hands-on experience. It brings the topics or the content I'm trying to teach to life, and it might excite them to even start a healthcare career.
What it does is it gives teachers new ways of approaching things, so that it becomes more exciting for the kids.
So many things are taught in a textbook, 2D drawings, and even when you pull videos up online, there are a lot of diagrams and computer-generated images. But when students can actually put an ultrasound probe, say, to a knee or to their neck and look at their own bodies, it just makes it real for them. It brings that reality to them, and it's going to plug them into their content that much more.
And so that gives students a visual as opposed to a plastic model on the table. They can see it in a living organism. They can see how the blood travels using Doppler. So I think it's a great application for the classroom.
I know I teach the cardiac cycle, so how the heart beats, and so the students have a really hard time learning about the valves and the heart sounds, so being able to see the valves moving and then to hear the heart sounds makes a huge difference.
You get a little bit of an idea there. As far as veterinary medicine is concerned, ultrasound is very widely used in veterinary medicine as well. I'm actually involved with this program here. It's called the Great Ape Heart Project, where what they found is that male gorillas in captivity tend to develop left ventricular hypertrophy and high blood pressure. So what we do is we go every Tuesday to the zoo and we scan the big gorillas, but it's not very easy to do. You can't actually go in the cage with them because they'll tear you apart. And the zoo would not let us sedate them more than one time per year. So what we do is we have to teach them how to do certain things in order for us to be able to scan them. So here I'll give you an example of that's when we sedated them, and we can do like a full echocardiogram on them. But we also monitor the pregnant gorillas, and what we have to do is listen a little bit to the clicking sound. You hear that clicking sound? So we teach the gorilla that they can't get a grape unless they hold on to these little kind of wooden things and push their tummy against the fence. So you can see how they have to push their tummy against the fence in order for us to scan them. So normally a scan that on a human being would take 20 minutes, it'll take us an hour and a half on the gorilla. But because we have to work with them and get them trained and figure out how to do this and see how they're getting a grape, and then they actually learn how to do this and help us out. So we do a lot of that with them as well, and it's really a lot of fun, and just keep up with their health and make sure that they're doing okay. So we also I've worked a lot with pig valves, porcine valves, and tracking pigs. So what we do is we develop kind of like a little hammock we put like a little window here, and then we can actually image the heart of the pig from below. And they can't run away because they're sitting in the hammock, so they're kind of happy and content. But yeah, I had to figure out how do I get this, and I couldn't get an image of a pig, and so I used AI to create this. So we also do a lot of community health fairs in order to teach the community about ultrasound and how useful it is. So here is a fair that we organized for one of the community members, and we invite them all, and we do a scan on their neck, and we show them their carotid arteries, and we look for plaque buildup, and to explain to them how this is it could be a precursor to having a stroke, and how they have to improve their diets and kind of get their blood pressure under control. So it really makes a big difference for them, because it's one thing to be able to hear it from your doctor, but it's another thing when your doctor holds the probe and stick it to your neck and say, see, you have plaque formation in your carotid artery, and if you're not careful, one of these can break and give you a stroke. So it makes it a little bit more real for them, and they're more compliant with their medication after that, just because they were able able to see it on their own body. And then we have something called an ultrathon. This is something that we're very proud of, and we do it every 2 years. And it's a biennial event. And what we do is we invite medical students from the entire southeast of the United States. So we advertise it for all the medical schools, and each medical school brings a group of 3 of their best students that they can pick. And they come from North Carolina, South Carolina, Georgia, Alabama, and Florida. So those are the medical schools that they participated this past year in 2024. And here's a little video about how that works.
All right, so she's gonna scan. If y'all wanna help her.
Time to start!
This is called the ACP Ultrathon. All these students come from all kind of medical schools in the Southeast, and they compete against each other.
It's an event for everyone to interact and to learn ultrasound in an educational, fun environment.
What will be your next step in treatment?
We've got a lecture, a live ultrasound competition in the Ultrasound Institute, and a quiz book.
A lot of the students are getting engaged in it. They love it, and it's been very collaborative.
Yeah, this is awesome. I really enjoy the time we've had here.
1 minute warning!
It's been intense, but a lot of learning today and very fun.
You guys did really, really well.
They did great. They were correct. I was a 55-year-old male.
We really hope people are able to leave here confident in their ultrasound skills and able to bring POCUS to the bedside in hospitals and in clinical practice.
Ultrathon is awesome.
If you want the best ultrasound education and curriculum in the nation, then you come to the University of South Carolina.
Ultrathon!
So it's a little bit of a fun kind of environment and competition, and all the medical students get to meet each other from different schools, and it's very collaborative, and it's been a very, very positive addition to the program as well. And that's something you guys can do as well. Invite people from the area, and you just play with ultrasound. Ultrasound is used regularly in research as well, and one of the projects that we're involved in recently has never been done before, and we're kind of like, promoting this first one. But we're doing a pediatric malnutrition study in Zambia. So what we do is we try to kind of, highlight where the acromion is and olecranon in the elbow, and then kind of at midpoint we put an ultrasound transducer right in it, and we get this image right here. And what we do is we kind of figure out where the subcutaneous fat layer is, and we measure that. And that can give us a lot of information about the nutrition status of the child, and then you can triage them better if they need critical care immediately, or they can wait a couple of days while another child, because the death rate is so high, and you're trying to figure out who do we need to approach first and who can wait a little bit. So it's really something that we're trying to figure out and maybe work. As far as assessment, how do we figure out that the students learn this? We have an ultrasound OSCE, and as you can see, it's a sheet like this where they have to perform certain tasks, and each task has 2.5 minutes or 3 minutes or something like this, where they actually have to do the scan themselves. So what we do is we have stations set up, like a computer, laptop, and they have to answer a question. Then we have different transducers on the table, and say, which transducer created the image that you see on the screen, or what is the frequency? Is this a low frequency transducer or a high frequency transducer? What is the advantage? What is disadvantage? Things like that. We have different things labeled on a mannequin, and they have to name the cardiac window or something like that. And then of course we use the simulators as well, because they're very objective, and they can tell you if you got the image or you didn't get the image. So the faculty member is not actually deciding for you, the simulator is deciding for you. So it really makes it more fair, because sometimes the students would complain that their friend got a much easier patient, and it was easier for them to get the point, versus me, I got the big guy, and it was really difficult for me to see it. So this way it just evens out the field, and everybody is the same. And you can see how at each station we have a faculty member, and here even in the M4 student who was being imaged himself for his knee, he is actually one of the faculty members kind of grading as well. So they're being scanned, and they also do the assessment as well, and we have one at each station. So that's just kind of a way we kind of do this. And this is just to give you an example, like one of the questions, what we would ask for. For example, get a longitudinal subxiphoid view of the left lobe of the liver, and then the proctor would have to decide, is the correct probe, was it used? Is the correct preset used? Is the probe marker pointing to the correct orientation? And then they have to answer certain questions and correctly identify structure. And they have to do all of this in 2.5 minutes. So this is not something that drags on and you have a lot of time to do. You have to be prepared. You have to know what you're doing. You have to know which probe to use, and you just do it, come in, and you just get it accomplished. So, you know, you can see how by the end of the 4th year, if you've been doing this for 4 years, you're really well prepared to kind of enter into the residency period as well. So the ultrasound wave is coming. So you can be this little guy right there, and you're going to get hit in the face with it, because the future really of ultrasound is very strong. And just to kind of show you where ultrasound is being used today, some of the unique places, it is the only imaging modality that's allowed on the space station. So they have ultrasound in space. Ultrasound is used on Mount Everest to kind of assess for pulmonary edema, to do kind of low oxygen environment and high altitudes. It's used in Antarctica because it's so remote. They don't have hospitals and clinics, and if there's an emergency, they have to be able to look inside the body very quickly. So that's one of the places. It's used in a lot of ambulances and helicopters and evacuation vessels, because you can do a quick assessment in the ambulance on the way there and be able to report to the emergency room that we found, you know, a pericardial effusion, so they can be a little bit more prepared as to how to handle the treatment right away. It is used in some of the remotest locations in the world where they don't have access to clinics and hospitals, you know, in Africa and Mongolia and South America. It's big in the battle and combat zones, because you can help triage soldiers so much easier and better, and make critical surgery decisions about who needs it and who can wait. So that's really one of the premier places that's being used today. And also, believe it or not, they use ultrasound underwater. So in Japan, they develop ultrasound machines that you can use underwater, and they're keeping up with the health of whale sharks and their pregnancies, and they can track them even underwater. Ultrasound is used. So I hope you kind of found this to be a little bit informative, and then get a little bit of an overview of how ultrasound is being used and what people are saying about it and where the future of ultrasound is going. So thank you very much.